It's always great to be back down in Rochester. I feel like I've been all over the state. I was in Moorhead, and then I was in Duluth for the debate with Al Franken on Wednesday. That went very, very well. And Thursday morning, we picked up the endorsement from the Duluth newspaper and the Fargo Moorhead newspaper.
You're looking younger, Mike.
I'm getting younger, yeah. Thank you. A new poll came out last night that had us within 2 points. So we got great momentum. We're going to win, and I just appreciate everyone's support in this room and in Rochester. Rochester is such a gem in the state of Minnesota, and it is a very appropriate place for me to talk about healthcare. And that's what I wanted to do today. I wanted to talk about Obamacare. I wanted to talk about the new rate increases, and I wanted to talk about my proposal for a better plan and a better way forward. First of all, with respect to healthcare, we have a healthcare issue in this country. I know that. I've been in business for 20 years, but I'm here to tell you that Obamacare is not the right answer. It's not the right solution. To quote Max Baucus, Democrat senator from Montana, it is a train wreck, and this train continues to wreck. And one of the things that is so frustrating about Obamacare is that it is the biggest, largest domestic policy initiative put in place in a generation. And it was put in place based upon lies. And that's a strong word, but I'm going to talk straight. It was based on lies. I mean, the first was, we all know that you can't keep your insurance policy, right? In spite of the president's promises. And as we know, Al Franken has voted with the president 97% of the time. They're connected at the hip. So the promise that you can keep your policy, not true. 144,000 Minnesotans found that out. The second promise that you could keep your doctor, unfortunately, many Minnesotans found out that that wasn't true either. But the biggest lie of all is that it will cost less. President Obama and Senator Franken have on multiple times said that this will make healthcare more affordable. President Obama said that it will lower the average cost of healthcare for a family in America by $2,500. That's just not true. And we saw the news a couple weeks ago that Preferred One was leaving the system. And Preferred One was the largest insurer to people that had signed up for healthcare under Minnesota's Obamacare exchange called MNsure. And they provided 60% of the policies in this market. They were the low-cost provider. And I know as a businessman, that when the low-cost provider leaves the market, you're going to have significant price increases. And I got to tell you, I was so disappointed and frustrated with the news conference that came out of the Capitol earlier this week, where they tried to use some funny math to say that that healthcare under MNsure was only rising 4.5%. That's blatantly not true. And as a Minnesotan, I am offended. It was deceptive. Where I come from the business community, this borders on fraud. And I got a little chart here, because I want to set the record straight. I want to talk math for a minute. And it's time that we talk a little math in this country, because we have some huge issues dealing with our financials. We have this chart here. This is straight talk. This is reality. This is what is really taking place. Healthcare is going up anywhere from 18% to 37%, depending on what plan you had. And all we did is look at what was the cheapest plan available last year on the Obamacare exchange in this state, and we compared it now to the new cheapest plan this year. Apples to apples. And it went anywhere from 18% to 37%. That's the facts, not my opinion. That's the truth. And that's what people need to know, and that's what people need to report about. Now, I have a plan. I have a proposal to make healthcare better. When I think about healthcare, there's three legs to the stool. There's cost, there's accessibility, and there's quality. Obamacare is not addressing costs. It's going to make healthcare more expensive. It's dangerous to quality. It's damaging quality, and it's questionable what it's done with respect to access. And my policy, my proposal is that I want a state-based, market-based, patient-centered program that's run here in Minnesota, not by the federal government. I don't want the federal government dictating and handling 1/6 of our economy. If we allow the federal government to do it, costs will go up, quality will go down, and it will look like the VA. And I just won't stand for that. Not as your U.S. Senator from the great state of Minnesota. So my proposal is on costs. There's 6 ways to drive down costs. One is health savings accounts. I'm a huge fan of health savings accounts. I want to see us promote those more vigorously. I'd also want to see increase in transparency. It's a simple concept, but I can tell you that healthcare is the most opaque industry in this country. It is so hard to figure out what things cost. If I'm going to have a knee replacement, which now has become a pretty common procedure, and I want to compare what it costs at Mayo versus Fairview versus up in St. Cloud, I can't get it. What they do is they break it down in 18 to 28 different procedures, and you can't compare apples to apples. That's an easy fix, and that will help drive down costs so we can do cost shopping. And when I read reports that something like a knee replacement might have a 400% price delta in the same marketplace, that's not right. It's just not right. There's a couple things I'd like to do with federal policy regarding buying insurance. I want people in Minnesota to be able to buy insurance across state lines. I want them to be able to buy it in Wisconsin or California. I want them to have more choices and more options, and that will drive down costs. I also want small businesses to have the opportunity to pool across state lines. Right now, they're not allowed to. So that will help small businesses. I can tell you the small business market in this state right now is just getting rocked with respect to price increases. I mean, it is horrible, and it's scary, and it's not right. In terms of tax law or taxes, I immediately want to rescind the medical device tax. And I also want to dramatically reform our tort system. So those 6 items will go towards cost. In terms of quality, I want to improve the FDA regulation process. The FDA regulatory process is out of control right now. The time that it takes to get a new medical product to market just continues to get longer and longer and longer, which increases the cost to get to market. So that needs to be addressed. Also, the ability to test new products in America. Nobody, I mean, Minnesota's been a cradle of medical innovation, but no one does their tests here because the regulations are too onerous. All the tests are now done in Europe or in Australia and New Zealand. And the practical effect of that is that U.S. citizens, we get medical technology 4 to 5 years later than they do where it's being tested. That's not right. I put forth that in America we're great at innovation. We're horrendous at regulation. And it's just not acceptable. We have to be great at regulation, frankly, to be a 21st century economic superpower. And then the last piece is accessibility. I want to maintain the opportunity for people that have pre-existing conditions that they can get health care at a reasonable cost. And I believe that the federal government can play a role in the funding of this, but I want the implementation of the programs to take place at a state level. And I believe that our old system where people with pre-existing conditions and they couldn't get health care at a reasonable rate, I believe that was wrong. I believe that was wrong. But when I put on my problem-solving hat and I roll up my sleeves from a policy standpoint, what we're talking about here is about 5 million people that fall into this pool, this high-risk pool, someone that had a pre-existing condition that can't get insurance at a reasonable rate, out of 318 million Americans. And from a policy standpoint, the question is, what's the most cost-effective, efficient way to subsidize this high-risk pool? And I don't want one size fits all. I want the federal government to be a funding source, but I want the states to implement the programs. I also am not a fan, nor do I support lifetime caps on insurance. So I would want that to continue to stay in place, that there's a ban on lifetime caps. And then the last thing is the opportunity for people up to 26 years old to stay on their parents' policy. I would support that. I would support that. So that is the underpinnings of my healthcare solution, my proposal to make our healthcare system the best that it can possibly be. So thank you for being here.